So doctor, much has been spoken about aortic valve.
Right.
For mitral, can the same kind of procedures be applied?
Yeah. So mitral actually is the area of research, because mitral valve disease is going to far exceed aortic valve disease, and already it does. So we need more mitral valve replacements than aortic valve replacements, more mitral valve repairs than any of the valves required, and we want to do this without surgery.
Doctor, please, if you can show it with the
So
model.
what happens, if you see, that's the mitral valve.
Yes.
So it looks more difficult than this rounded aortic valve. So these valves are more difficult to design to fit this area, and this area keeps changing if the heart is big or the heart is small, or if it is leaking or it is narrowed. So mitral valve therapy is in the pipeline, it is being researched, and that is going to be the future. So where are we in the mitral space today? That's the important question. So I'm going to keep this model down and tell you where are we in the mitral space today. So one, if a surgeon has replaced a mitral valve in the past, which is a tissue valve, and if it degenerates, as I told you, it lasts 10 to 15 years, we can replace this mitral valve without opening his chest, the same route as we did the TAVI. Now, why do we need to do this and not do redo surgery? If we do redo surgery, any redo cardiac surgery carries a higher mortality, and I mean mortality, the chance of dying, and more time to recover. So we have a great option that we can replace these valves without surgery. So in a previously implanted surgical valve, TMVR is already there, we are doing it.